Hi, this is John Kanopoulos from Athens, Greece, clinical professor of ophthalmology, NYU Medical School, New York City, New York. One will wonder, what is a cross-linking device doing with a VisionMax 800 femtosecond laser? And this is a suspect cornea. It's not keratoconus, but our thinnest on Pentacam is under 490. These are the topographies, and the refractive error is very small. So we opted to go with Smile. Here on OCT, the minimal thickness is 490 in both eyes. So we opted in this patient who was traveling and insisted not to have PRK to, you see the corneas are normal. He's 35 years old. We opted to do Smile. For this small refractive error, spherical equivalent was minus 1.75. Myopia and astigmatism, we're engaging the VisionMax 800, doing Smile in a standard procedure. The only difference is we used a 160 micron cap instead of 120 cap, and this in lieu of not changing the anterior cornea stromal biomechanics. So 160 micron cap, we're seeing here the VisionMax view. It's amazing that the VisionMax 800 creates the lenticule in just 8 seconds, and the procedure parts are accelerated ×2. We're going in with our olive tip spatula to remove the lenticule, and the difference here is that following rinsing, we'll introduce, after the other eye is performed as well, riboflavin solution 0.1%. The other eye follows same suit. Nothing really in particular besides the fact, as I mentioned, the cap here is 160 microns instead of our standard 120. We're doing a 6 millimeter optical zone and rinsing regularly. But after this, we'll go in, as you can see here, with riboflavin 0.1%. We will instill the riboflavin in the other eye as well. We'll wait 3 minutes, and then we'll rinse the riboflavin off, riboflavin in the second eye here, and then we'll go 3 minutes later to the first eye and rinse off the riboflavin for the interface and perform a 30 milliwatt per centimeter square CXL for 2 minutes. So a adjunct CXL procedure. So we'll name this SmilePro Xtra. Rinsing off following the CXL procedure, and then going to the other eye, rinsing off the residual riboflavin. Again, a CXL session for 2 minutes with 30 milliwatts per centimeter square effluence. You can see here some clinical images of the procedure. And then go back, rinse off corticosteroids, antibiotics for 1 week. Patient is 2016 the next day. As you can see here, I can tell there's some cross-linking in the cap. The Pentacam maps are impeccable. Really nice result. This is the left eye. Pentacam maps of the left eye here again. Impeccable procedure. And here the OCT images of the right and left, and we can see the delineation CXL line at 160 microns of the cap. John Kanopoulos signing out. Thanks so much for your attention.